The best results happen when great surgeons work with great technology. Here we have some of the most advanced image navigation platforms and microscopic platforms at this operating room. This is the Pulse neuronavigation system. This uses a stereoscopic three-dimensional camera visualization system with these balls which register the anatomy in space and allows us in real time to see beneath the skin, through the surface, through the bone, what anatomy we're looking at. This allows us to use the most minimally invasive methods and techniques and still achieve results that are superior to traditional spinal surgery. This is obtained simply by obtaining a scan with this device behind us while the patient is in the operating room. We then use this camera system which registers this array, and at that point, all of our instruments that we use in spinal surgery, including the screw placement devices, drills, taps, even tools we use to place what are called interbodies or implants, can be navigated in real time so that the surgeon can look at the anatomy and also visualize the anatomy on the screen to confirm what they expect to see or maybe what they couldn't see because of the small incisions they were using. This platform, called the invasive Pulse, is also excellent because it marries this wonderful navigation package with millimeter accuracy with their well-established and time-tested neuromonitoring platform. The neuromonitoring platform allows us to monitor patients' nerve function in real time to know not only how close our instruments are to actual functioning nerves, but to ensure that we keep them safe as we decompress them and place implants. This navigation platform is truly excellent and truly special compared to others in the ability to marry those two excellent technologies for a surgery. Sometimes, even with this great technology, we need to increase our visualization further. And for that, we have things like this excellent Zeiss microscope. This microscope has an extremely high level of magnification and light. It balances in space, where the entire machine is controlled by a gyroscope, and can move with just the gentle touch of a finger. This allows me to clearly visualize microscopic, millimeter-sized anatomy. That hole right there is about 4 millimeters in size. With these two technologies, it allows us to give the most precise, accurate, and advanced approach to spinal surgery.